kwa sababu ya ukosefu wa matibabu na kunyanyasa maafisa wa ugani ambao wanatembea kuangalia wagonjwa katika vijijini. Mstahiki Spika, utapata wale tabibu wa ugani kwamba wanatembea kwa mguu kama mawakala wa ng'ombe. Hawana njia yoyote ya usafiri ya kuwafikisha vijijini ambapo watu wetu wanaishi, mahali ambapo nyanya zetu wanaishi, na wamepewa kazi na mikoba mizito ambao wanafaa kuzunguka nazo. Wamebeba mizigo kama punda hivi kwamba hawezi kuwafikia na wanakuwa wamechoka wakati wana. Mstahiki Spika, ningeomba usaidizi wako kwa sababu na hapa kuna tafsiri inaendelea hapa ambayo
Majority Leader, Majority Whip, Deputy Majority Leader.
Mheshimiwa Karwale, unaitwa na Speaker.
Majority Leader, mnamsumbua Senator Murango akichangia. Tafadhali mpatieni nafasi tumsikize kwa umakini.
Asante sana Mstahiki Spika. Nilikuwa nasema kwamba wale maafisa wa ugani ambao wamepewa kazi ngumu na mikomba mizito ambao wanambembeshwa midhili ya punda kuzunguka kuangalia wagonjwa katika vijiji zetu, na ambao kulipa wanja lipwa kwa miezi, ni jambo limekuwa la busara kuhakikisha kwamba wale watu wengine wanapolipwa ni vizuri waweze kulipwa pesa zao ili waweze kufanya kazi yao kwa ufasaha. Mstahiki Spika, huwa anasema kwamba ni vizuri hata kama gavana hata jenga barabara, afadhali akose hata kupeana mbegu na pembejeo za kilimo, lakini hakikisha kwamba afya imefikia kila mtu, kwa sababu aliyekufa hawezi tembelea barabara zilizoundwa, aliyekufa hawezi hata kulima. Kwa hivyo ni vizuri kwamba waachane na mambo yote ambao wanaofanya kuhakikisha kwamba wakazi wote wako hai. Mstahiki Spika, pale Kirinyaga, baada ya kuleta taarifa ambayo tulituma katika kamati ya afya ambayo inaongozwa na Mandago, Mheshimiwa Mandago, Senator Mandago, kumekuwa na mambo mengi yanafanywa kuonyesha kwamba sisi hatujui venye tunafanya. Katika pale ukiangalia katika pale mlangoni kumewekwa mzee na mama amekaa pale, ukiingia na kupiga pambaja anakushika mashavu, ili zile picha zirushwe katika vyombo vya habari ione kwamba mangavana wanafanya kazi. Na mimi husema kwamba kweli watu tunachaguana, na unajua Swahili husema kimbembacho kikivunja nafuu kwa mchukuzi, lakini kama kuna mahali ya tambu ambapo watu wanafaa kuja kuona kifo kwa macho ni Kirinyaga, katika idara ambayo inapeana afya katika pale Kirinyaga. Nikimalizia nitasema ya kwamba ni vizuri wale wahusika na wale madaktari ambao wanahusika kutupatia afya, ambao wanahakikisha kwamba tuko hai, waweze kulipwa pesa zao wakati unaofaa. Wale ni wazazi, wanalipa kondi na wanalipa pia karo za shule, ili waweze kutufanyia kazi. Asante sana Mstahiki Speaker.
Asante. Senator Moses Kajwang.
Mr. Speaker, I also would wish to emphasize a few matters raised by Senator SIFUNA, the senator from Nairobi, particularly with regards to the community health practitioners. Mr. Speaker, in the last session, you directed a small delegation to go into mediation with the National Assembly over the county government's additional allocation bill. I was privileged to be part of that delegation. And Mr. Speaker, I believe that the leader of our delegation, Senator Mutinda, ought to bring a report back to this House because mediation collapsed. The talks have collapsed because the National Assembly is insistent that the Road Maintenance Levy Fund should not go to county governments, but should go to the Kenya Rural Roads Agency. The relevance between the additional allocations bill and Senator Sifuna's statement is that the money that community health practitioners are supposed to get was included in the schedule of the additional allocations. Mr. Speaker, you recall when you were in Turkana, we processed the health laws, and there were 4 laws. Mr. Speaker, they are some of the worst laws we have ever written. When you look at them, when you reflect on what we did in Turkana, we need to do a legislative impact analysis so that we clean up those laws. Part of the laws we passed, we allowed the national government to pay community health practitioners half their salary and county governments to pay half the salary. 2,500 was to come from the national government, 2,500 was to come from county governments. We have a situation, Mr. Speaker, where you find that the national government has sent 2,500, but the county government has not. Or the county government has sent 2,500 and the national government has not. That is not the way to treat our frontline health workers and the people that we are entrusting to deliver the dream of universal health. Mr. Speaker, if we do not resolve that impasse, then it means that we don't have a proper legal framework for payment of community health practitioners. I am told right now the national government is sending the full amount direct to them. But that is killing devolution, because these are employees and agents of county governments. They cannot be converted to be agents of the national government. We need to deal with this matter as a matter of urgency. And Mr. Speaker, even though I've seen a motion or notice of a motion in the order paper that we will be dissolving committees, the health committee, the gentlemen and women who will go into that health committee, I want to urge them that the first inquiry that they should embark on, and I think this House must also register its compliments to Governor Senator Mandago for the robust manner in which he has handled the Health Committee as chair, because he has brought visibility to the Senate and visibility to the activities of that committee. But this issue of social health authority, Mr. Speaker, we must go back to those laws that we passed in Turkana. The issue of registration of indigents, I think they're called indigents. When we were in Naivasha, we were told by the Commission on Revenue Allocation that the health data that is coming from county governments cannot be trusted. And it was on that basis that they dropped the old indicators or the old variables that we were using for dividing revenue amongst county governments. Why? Because they claim that counties are either underreporting or over-reporting. We saw a typical case where in a certain year you had 90,000 hospital admissions, and then today you have 400,000 hospital admissions. Are we going to trust the records and the data that is coming out of this SHA registration being done by the community health professionals? County governments have already known that if they register more, then more money is sent to those facilities. Mr. Speaker, let us be honest with ourselves. Our county governments are gaming the system. They know that if a health facility registers more people, more money will go there. And they are going to register ghost people because there is no cost to registration. Once you register, there's a capitation of 900 shillings that goes to that facility. The second thing we have to ask ourselves is whether that capitation of 900 shillings is adequate to provide universal health. Mr. Speaker, the third thing that this committee must investigate is the issue of medical equipment placement. Mr. Speaker, that thing is a scam. We said it in my committee, and the next day the president was at the coast. He said that our heads are not proper because we are questioning that matter. We shall continue questioning things that do not make sense because they touch on the most vulnerable in this country. Mr. Speaker, as this committee processes this statement, I do pray that they are going to launch a full inquiry into the state of universal health, into the state of legislation, into the welfare and plight of community health practitioners. But, Mr. Speaker, please direct that the team that went into mediation with the National Assembly should bring back a report. I know it is not in our standing orders, but if 42 billion cannot go to counties because of failure of mediation, Mr. Speaker, I believe that that committee or that delegation has a responsibility to come back. I support Mr. Speaker.
Thank you, Senator Kajwang, and welcome back. Senator Karen NYAMU.
Oh, will you? Oh, it's on now, Mr. Speaker. Thank you, Mr. Speaker. I want to thank my head of delegation, Nairobi delegation, Senator SIFUNA, for bringing this very important statement before the floor of the House. Last year, Senator SIFUNA did convene a meeting of 1,000 towards the end, during the recess, towards the end of last year, in the December holidays. He did convene as part of our oversight, Nairobi delegation oversight program, a meeting of 1,000 CHPs from Nairobi County, where we got this very key feedback, a very shocking feedback, actually, Mr. Speaker. The CHPs are operating without the phones that have the latest technology. They're doing very key role to register even the share of the people in the ground using very poor facilitation if what the funds they're using is anything to go by, Mr. Speaker. The mood of the country right now is to embrace universal health care. And that should be reflected in how we facilitate, in how we empower our CHPs. Mr. Speaker, we cherish the work that they do, bridging the gap between the ground and the health facilities and the health institutions and the health care providers, Mr. Speaker. I want to urge the committee, the health committee, as they investigate what SIFUNA has presented, to come up with proposals that are going to empower this very key component of universal health care. 107,000 in the country, 7,800 in Nairobi, doing a very key role in the health sector. Mr. Speaker, find ways and propose ways where we can empower them so that this key role is effectively done, Mr. Speaker. Thank you.
Senator Eddie Okech.
Thank you, Mr. Speaker. Mr. Speaker, the issue of community health workers, I think that we as a House must pronounce these community health promoters as at-risk population. I think that when we use very palatable and educative terms like what Senator of Homa Bay has used, and you say they are frontline workers, health workers, then it sounds really beautiful. But I think that we need to call them an at-risk population. And this is my reason, Mr. Speaker. Mr. Speaker, I want you to picture a community health promoter who every single day has to go to a house to go and check on a TB patient that they don't know as TB, or any other infectious diseases that they might interact with these different patients that they don't know are patients. Because the way this happens, Mr. Speaker, is that they are the first people to engage our people on the ground without capacity to, number one, detect any kind of diseases that the people they're interacting with might have. Number two, they don't have